All right. Well, thank you for joining today's Social Care Network stakeholders meeting. My name is Alexa Hawley, and I'm the event specialist. Just want to, again, welcome all of you and encourage you all to, excuse me, keep yourselves on camera, turn yourselves off mute, engage in the conversation as much as you can, as much as you'd like. Ask any questions that you may have throughout today's session. The session is being recorded and will be posted to our website at a later date. And I also would like you to, if you have any technical issues, please feel free to chat myself or Melissa Gussman. We'd be happy to help you with any technical issues. And we'll be monitoring the chat throughout. At this point, I'd like to turn it over to Amira Fifi. She is our community engagement specialist, and she'll be running through today's agenda and then kicking it off for us. Thanks so much.
Hey everyone, as Alexa said, my name is Amira Afifi. We have a full agenda today. We're going to start off with our provider spotlights. We have YMCA of Tompkins County, Halco Energy, and Reach Medical here to share. Melissa Gussman, our marketing and communications manager, will be going through some marketing and advertising updates. Olivia Berlew is here to give us some new invoicing standards. And then Dina Hodges, our IT program manager and in-house Unitas expert, is going to go through some insights overview. Then we'll be handing it over to Nicole Cashman, our network operations manager, to go over the provider scorecards. And then Lauren Gretko, our social care network director, will be going over the 1115 waiver extension updates and performance updates. So to start us off is Kurt Clefield with YMC of Tompkins County. I'm going to turn it over to you, Kurt. Just let me know when you want me to advance slides.
Sure, that's great. Thank you so much, Mira. So I saw that I was in really good company today. Really excited about being presenting along with Hal and Sam, who I've both worked with before. So that's great. So I'll start with just a brief overview. My name is Kurt. I'm the Director of Community Health at the Y of Ithaca and Tompkins County, and also the Cortland Family YMCA out in Cortland County. But for the purposes of 1115 waiver and Care Compass work, just focusing on the Ithaca and Tompkins County program and our food security programming, specifically with the 1115. You can go to the next slide, please. So they asked me to do like a 5 to 10. I'm going to try to keep it on the 5 time, but I do get loquacious, so I'll try to go. I'll try to go as quickly as I can. So just a brief overview of the facility to start. So we have a 53,000 square foot facility. It has 2 indoor pools. The one's an 8-lane pool, and so we do a lot of swim lessons. We actually lead the county with amount of swim lessons. And as you may know, the leading cause of death between 0 and 2-year-olds is drowning. And so we try to put emphasis on improving community life as much as we can. We have lots of grants going on all the time so that we can provide that for membership for sure, but also open community whenever we are able. The Ithaca Tompkins County just recently got the New York Swims grant, which was an $8.2 million grant to revitalize our pool and add and take our second pool, which is a sort of smaller pool, and add another pool that's also Olympic size in addition. So we're excited about that, revamping locker rooms and all kinds of things. We have a huge gymnasium, full-size gymnasium. We're getting a new floor for that, which is exciting. A functional training center, a circuit room, which are the machines that you use pins on, a cardio center. So those are all the cardio workout equipments like treadmills and bikes and that kind of stuff. Lots of group exercise classes, walk-in childcare. We have one of the largest childcare facilities in Tompkins County, an after-school program, a camp program. We also have, as far as nutrition is concerned, an on-site food pantry, which is one of the biggest in Tompkins County as well. We have a nutrition center with program space, racquetball courts, an OEC, an outdoor education center where we can have camps and trails, and we have a disc golf course there, that kind of thing. Right now, we have about 4,700 members, about 150 staff. Of those 150 staff, 12 are full-time director level staff or administrative staff, and most of our staff is part-time. So if you think about the Y, We use a lot of lifeguards and students to do sort of welcome center work and child care workers, that kind of thing. And most of those folks are part-time. So we offer a huge variety of programs, youth and adult sports, swim lessons, as I already said, group exercise, STEAM programs, Red Cross certifications, financial assistance, pantry stocking. And then the area that I sort of cover in addition to food security is chronic disease prevention programs. And I just wanted to mention those a little bit before I go on to our enhanced services that we provide. So you can go to the next slide, please. Yeah, so as everybody knows, the way to improve health outcomes in folks, 20% of that is our healthcare system. And the huge part of it, 40% of that is our socioeconomic factors, which we can't change. And so understanding that those are the basis for things, and that health behaviors are long-term change. We try to put a lot of focus on working with people on their chronic conditions and trying to work on healthy behaviors. And we know that that is a huge route to helping people's physical and mental health. You can move down to the next slide, please. Yeah, so I wanted to mention our chronic disease programs that we have in place. So we have these different programs. A big one at the Y in Ithaca is Live Strong, which is our cancer survivorship program. We started that 4 years ago, and we just graduated our 28th cohort of folks. So this is anybody that's ever been diagnosed with cancer. It doesn't matter what kind and when. And it's basically getting back to the movement that they were accustomed to before things like treatment and surgeries and just living with cancer. And so it's a very interactive program. It's not a support group as much as a fitness program to get back into things. Moving for Better Balance is one of my favorites. It's high chi based movement class. This is if for usually for older adults who are worried about mobility or falling or something like that. And this just focuses on the center of yourself as a person and how you move throughout the world. And it's Tai Chi based. It's really cool to see. But we also have blood pressure self-management program, diabetes prevention program, several other programs. All right, I just wanted to hit all of the things that are sort of half of my work at the Y, in addition to the work that I do with the 1115 waiver. We can move on, please. So those HRSN services that the Y currently does are screening and navigation. We do cooking supplies for all counties. So the way we address cooking supplies is I accept a referral. I talk to a person, find out exactly what they need to support their healthiest living and cooking responsibilities. And then if that's covered under their waiver, I simply buy that stuff from a site and have it delivered directly to their home. So it doesn't really matter where they are in the Care Compass region. We can do that. Medically tailored prescription food boxes. So we have a registered dietitian on staff. So when I accept a referral, I pop it over to her to look at, to see what chronic conditions are going on and what makes the most sense for that person. And then we've partnered with a local BIPOC-owned farm who does all the fulfillment of those boxes. And so they are packing weekly from their cold growing stock and from their and from their farming. But then they've also partnered with several other farms to be able to get things like organic eggs that one of their chicken farmers has. Or grains or seeds or lots of other places. And so together they cull that all together into a food box based on my registered dietitian's advice on that person. And then the Y does the delivery portion of that. So we're actually taking that to a person and handing it to them every week for each person. So If you've heard of other programs that provide that kind of service, but it's FedEx through the mail or packed with dry ice or something like that, and coming from a state far away, that's a different program. And I'm not making judgment on that. I'm just letting you know that ours are all grown locally right here in Tompkins County and delivered to people by people from CBO in Tompkins County. We also do pantry stocking. We have a pretty large pantry, like I already mentioned, right on site that's open twice a week, a 3-day pantry. And in addition to that, we have 2 satellite pantries located at the Cuga Mall and Cuga Park. And then I also have a mobile pantry where we'll go take out to various locations that are grocery store and food deserts to be able to pass out food to people in need in those different places. And then lastly, I have nutrition counseling. So that registered dietitian that I have on staff will call the person up in most cases. There's been 1 or 2 where the person has wanted to come in and be in person, which is fine. We do that too. But the reason we can do all counties there again is because most of those are phone calls for counseling. And those are for all eligible populations. So anybody on the list, regardless of the reason why they got there, we can serve. Okay, you can go to the next slide, please. Yeah, so I just those food security, I just wanted to review that whole food security. There's a picture of the Y truck pulling our refrigerated trailer, and then the picture below is it's the same Y truck, but that's our mobile pantry. That is out in Newfield. We were able to work with the Newfield Dandy Mart and park in their parking lot, and that day that picture is taken. We served 87 people with food. I know that Enfield also has a large pantry that's open a couple of days a week, but it's very clear that people are in need of food, even more than that. And then there's a picture of my scooter navigator working with a couple of people on a mobile pantry day as well. But those are all the sort of food security ways that we're addressing food security in Tompkins County and beyond. I think that's all I have for you. If there's any questions or if you need further information, there is my number and my email. Yeah, thanks so much for listening.
Are there any questions for Kurt? Thank you very much, Kurt.
Yeah.
I just dropped your website in the chat too. All right, next up is Andrea and Hal from Halco.
Hello, everyone. Next slide. Over a little overview of Halco. We're a multi-region presence. We are headquartered in Phelps, New York. We have operations out of there, also operations out of Ithaca. We also have satellite offices in Syracuse and Rochester. Our county reach is 23 counties, including those within the Care Compass SCN. 42 years of experience, 4 decades of expertise in HVAC, plumbing, electrical, healthy homes, and energy efficiency. A lot of what this program is looking for, Halco has been doing this for many, many years, so it's been a nice fit for the company. And we're a full service home performance contractor from assessment through the completed work. A little bit about my background, because I haven't been there 42 years with Hal. I've been a registered nurse for 34 years, with my last role being as director of nursing and primary care. Decided to join Hal at Halco approximately 9 months ago to help with the IAQ division, and found out that there was an opportunity with this program. So it's been a great transition with my role in primary care into supporting this work. So very excited to partner with all of you. Hal, anything about Halco you want to add?
Yeah, I just want to make sure everybody understands Andrea didn't agree to join Helco until after I married her. So she, I'm going to get in trouble for saying that one, but yeah, no, this is exciting because you know, we've for years have been doing lots of indoor air quality work. We recently have all of our people with these air advice electronic indoor air quality tests. We can do an initial 30-minute test, and it gives us a lab report back within just a few minutes after the 30-minute test, and it tests on 5 different, you know, particulates and uh, VOCs and humidity and temperature and carbon monoxide, carbon dioxide, gives us all the reports back on indoor air quality and such in the home. So it's exciting to pull all this together.
Next slide. So we support multiple components of the NIHER program. We do the screening, navigation, and enhanced care management. So we take referrals at any point within that process. And then for the home housing service, we do the home and safety modifications, home remediation with pest and mold, ventilation improving systems, the equipment provision. We do the ASMEs and the asthma remediation and supportive products as well. Next slide. So for the home and safety modifications, we do our dwelling assessments, which does include a comprehensive safety assessment through Age Safe America. As far as the dwelling work, we do ramps, bathroom facilities, doors, cabinet handles, electric door openers, grab bars, handrails, non-skid surfaces, pathways, door widening, anything that is covered within that home and safety modification component we offer at Halco. You will see at the end our tagline for the company is, yes, we do that. So again, everything we've been doing all along aligns to everything that this program is allowing to support these clients. Next slide. Mold and pest remediation. We do ventilation, so dwelling assessments around that. We do air conditioning, air filtration devices, dehumidifiers, humidifiers, heaters. We do the equipment provision. So if somebody is in need of a mini fridge for breast milk storage or to support their medication storage, we offer that as well. Next slide. We do the asthma self-management education and also the asthma remediation and provision of supportive products. If we have those two referrals together, we do those as a appointment together. So we had the ASME education going on, and we also have our HSC, which is our home solutions expert, come in. And we like that model because we're able to identify the triggers and talk about ways to support reducing those triggers. And we have that home solutions expert right there to connect the dots on what's going on in their house that is probably having those triggers get out of control to begin with. So is it the mold? Is it the wet basements? And then we're able to help them understand if this gets done, you know, there's a good chance that we can reduce that. And you know, the goal obviously is to reduce those triggers altogether. Next slide. So our dwelling assessments are done by our home solution experts and our indoor air quality specialists. They are certified by the Building Performance Institute in Healthy Home Principles and Building Science Principles. They also are certified as Age Safe America Certified Home Safety Specialist. So again, a lot of times that will be a team that goes out depending on whether that ASME is required as well, because the IAQ specialists also have the American Lung Association certification for the ASME. Next slide. So what can you expect to receive with the dwelling assessment from Halco? You'll get the comprehensive environmental assessment. We do blower door testing, and I'll let Hale talk about what these things would give you insight into: heat loss, heat gain calculation, a polycam drawing of the house, and an indoor air quality testing from Air Advice. And this picture here is showing an example of that Air Advice test that Hale talked about previously.
Yeah, you know, people would wonder what does a blower door test have to do with all this? Well, blower door test is going to determine the leakage rate of a house. And from that blower door test, we're going to calculate how many air changes uh, per minute the house is. And we find houses that are 20 plus air changes, and we air seal and insulate the home, and we'll get them down to code standards of less than 5 air changes. So you take a day like today with all the Canadian smoke problems we're having, somebody with 20 air changes, that's a lot of those pollutants from outside through their house. And when you are able to seal their house up, you can control the environment inside. So
How about the Polycam and the heat loss, heat gain?
yeah, we use the latest technology with all of our assessments. Where we go out with these iPad Pros with LiDAR scanning. So this Polycam, we used to have to spend a couple hours sketching out a house for the floor plan to design. And this Polycam with this LiDAR, you go in with this iPad Pro, you scan the house, and it draws a complete floor plan of the house in minutes. And the same thing when we do heat loss, heat gain calculations, which you have to do the blower door, all that. That's also a LiDAR scan. So we're keeping up with the latest and greatest technology to make things more efficient.
And what that allows us to do is put a thorough scope of work together, and having all that information helps on the technical review side of it as well. So there's a good understanding of, we're proposing this because of these things that we're giving you, these data sets that we're including with the dwelling assessment. Next slide. And just wanted to say thank you, and we look forward to partnering with you. We're just getting started doing some of the work. We've definitely received some referrals from all of you, so looking forward to continuing to work together. And I did see a chat in there from Kurt. I'm glad that you had a good experience with your home assessment. I think they do a fantastic job. Our team is a great team we have.
Appreciate that, Kurt. Thank you.
Thank you, Andrea and Hal. Do anybody have any questions? Okay, you can drop them in the chat if you do. Next up is Samantha Stevenson with Reach.
Hi, everyone. I'm Samantha. I'm the Director of Operations at Reach Medical. Thank you for having me. I do want to give a disclosure that I'm unexpectedly working from home, and there are many kids here. So if you hear loud crashes, just all the parents on the call can just bear with me and understand that that's what's happening. So everyone's okay. It's just noisy. So Reach Medical is a nonprofit, low threshold, patient-centered harm reduction medical facility. We have a lot of integrated services that I will talk about in just a minute. We opened about close to 9 years ago. So in nonprofit world, that means that we're just now coming closer to the 10-year mark, getting more and more foundation, getting our footing more, continuing to expand. We really are a mission-driven organization. We focus heavily on the folks that kind of, like many of us on this call, that kind of get left behind by the traditional healthcare systems. So we are a community-based organization. We really work. We don't turn any patients away based on their type of insurance, their lack of insurance, any of their social determinants of health. We offer a wide range of services. We have a really large MAT program. For those that don't know, that's medication assisted therapy. So people that are living with substance use disorders. Across the state, we have approximately 10,000 patients that we serve in that MAT program through telehealth. Locally in Tompkins County, is our highest served county, of course. And we have right around 2,000 unique patients that we serve in MAT in Tompkins. We also treat a lot of hepatitis C. We do a lot of HIV testing and treatment. We have primary care, acute care. We have daily walk-in visits available. We have a fully integrated behavioral health department, and we do real-time crisis management. We do psychiatric medication management. We do individual counseling. We do group counseling each week. We have a food pantry that we opened in January. We have intensive case management. We offer the LEAD program, which stands for Law Enforcement Assisted Diversion. That is that's a very diverse group of people in the community that work together to pull people out of the criminal justice system and into case management. So that's for folks that are kind of chronically having police contact, chronically getting arrested for low-level crimes that are rooted in substance use or behavioral health. So those folks kind of get a referral to us. We work with them on their social determinants of health, housing, behavioral health, addiction medicine, kind of whatever the need is there. I think let's go to the next slide. So right now, our SCN services that we provide, we are a transportation service provider for the SCN. We're also working on, I think for us, it was tricky for us to figure out initially kind of where we fit into the 1115 waiver because we're an OASIS licensed facility. So we have our New York State addiction medicine license through OASIS. So that means that we get some increased reimbursements for Medicaid services and Medicaid claims. Some of those reimbursements and so we can't obviously get both. We can't get that reimbursement and also get an 1115 reimbursement because that's double dipping. So we started with transportation. We're working on a really large development project right now for medical respite. So, and we hope, I think none of us feel exactly certain on how the 1115 waiver will land in the future, but we hope that it will continue to be in effect and we will be able to open up a medical respite facility. In New York State, there's only a handful of respite facilities. They're all downstate. They're all in the city. There's nothing in our entire area. The medical respite facility itself would take people bed to bed. So no one in Tompkins County experiencing homelessness would ever be discharged from the hospital into homelessness again. They would be able to come into the respite facility, recover, rest, stay there for up to 90 days. So in addition to our transportation services, that's kind of what we're working on, and we hope to kind of plug into that in the future. I think I saw a chat question. Hang on, let me check that out.
There was a question about the
About LEAD.
Yeah.
It can come from either. We take community-based referrals and law enforcement referrals. Next slide, please. Okay, so we talked about a lot of this. We have, in addition, I think one thing that I left out is we have a wide spectrum of outreach services. So we have a really large outreach team that goes out into the community 5 days a week. They go into local encampments. They do community responses. We are the contracted provider for downtown services as well. So all of the downtown business owners and stakeholders are able to call us when they encounter someone in the downtown area that looks like they could use some assistance or de-escalation. We work on wound care. Coming online at the end of the summer, we have a large residency grant with CMC that will put resident doctors out with our outreach team 5 days a week so that they can do real street medicine with a provider, which is great. We also, with the 1115, we're granted a behavioral health expansion grant that we're just beginning to build out. This will expand our hours of our existing model into evenings and potentially weekends. We'll be able to expand our existing model, we hope, by at least 50%. Medical respite I talked about. And we also, we just launched a boots on the ground in community grant in Broome County. So we have a large medical RV unit, And that's out there 5 days a week in Broome County. And we're seeing people in real time there too. And that will be a 2-year grant. We hope to kind of stay in Broome County once we get established with that initiative as well. And that's it. Here's my contact information is here, and this is the address to our new office that's in the downtown area, right on the Commons. It's great. It's a really large office space. We have a fully operational drop-in center 5 days a week. That's also a navigation hub, so people can come in. They can get services in real time. They don't have to be established with us in any way. They can just walk in. They can get the help they need. They can visit the food pantry. They can see a medical provider if they need. We do real-time intakes for addiction medicine and behavioral health. So any questions, feel free to reach out to me, and thank you so much.
Thank you, Samantha. Great. Next up, I believe, is Melissa with our marketing and advertising updates.
Hey, Amira, sorry to cut you off, Melissa. There was just a question in the Q&A box. I just wanted to address that as we were wrapping up partner spotlights. It reads, is there anyone on the platform doing the actual pest removal at this point? And if there's not an answer, perhaps I can take that back and we can reach out with the answer.
I can follow up. Thank you.
Super. Thank you. Thanks, Nicole. All right. So sorry. Thank you, Melissa. Thanks, Amira.
All right. So I am Melissa Gussman. I am the Marketing and Communications Manager at Care Compass. And I just wanted to share with everybody on the call, some of the things that we're doing, at Care Compass to help push out, the program and the work that everyone is doing. So for us, this is just some of the advertising things that we've been doing since April of this year. So we have, some TV, we're doing some streaming, some digital ads, like social media and that sort of thing, Google. We also have some transit ads that'll be going out throughout this year in Ithaca, Broome, and Otsego counties. We've also had a couple features in the media. So we did Around the Tiers, and then we also had a radio interview. Both were done in April. And then we're going to be doing a mailing out to Medicaid letters, and that's going to go across to probably about 10,000-ish Medicaid members across our 6 counties. And some of the last things we're kind of working on is some billboards. So we've got, some things going on this month. We're out in around Watson Boulevard. And then in August, September, we're going to have some other ones out towards like the Green area, Owego, Sherburne, and Norwich. And then on the right, you can kind of see this is just some of the advertising that we're doing. Some of it's going to be very targeted to, certain areas where we know we have large numbers of Medicaid members that we need to get screened. If we know that we have like food deserts, we're going to be pushing out some nutrition ads in there to kind of do a little bit more of a targeted, kind of push. Next slide. And then also on top of the advertising that we're doing are sharing some of the member stories that you guys have submitted to us. And this is just a few of the ones that we do. So, it's really important. We have the numbers, but the numbers only tell one story. Having these stories share the human side of this, it puts a face to that number, and really shows that we're doing something out there. We're really making a difference in someone's life. And one of the quotes I just love, and it was shared by OAR out in Tompkins, was, "I am capable of growth and deserving of the same opportunities as anyone else." And that quote from that member just always gets me every single time, because it's really like, that meant something to them. It changed their life by having something as simple as a place to live, food on the table, a ride, some of the things that many of us do take advantage of because we have the means to do it. But for many of our members and some of our most vulnerable community people, that means everything to them. Next slide. And then this is the last thing I have out there, is again, just kind of shouting out our marketing toolkit. So we have been putting together, printed materials that you can have co-branded with your information on it. We've got posters, flyers, postcards, business cards. We also have a variety of some, digital graphics that you can put out on Facebook or Instagram. And then the state also had a video reel that kind of just very generic. What is the Social Care Network program? And that is also something that, you know, you can download and share, whether it's on YouTube or Facebook, Instagram, that sort of thing. So all of those things can be requested to be, you know, branded with your logo, your contact information, website, and that sort of thing. And I'll drop that link into the actual chat box, you know, for everybody. And that was it. So it's a lot of moving pieces kind of going out there, but, you know, one of the things is constantly sharing, you know, what is this program? You know, how can it help? You know, and that other piece is sharing the stories that you guys share with us that really shows that human side of the program and how big of an impact this really is doing beyond just, you know, we've screened X amount of people. I think that is, let me see. Oh, Kurt, that's great. I'm so glad you saw our ad on Amazon Prime. Yeah, we've been putting it out there everywhere, trying to get as big of a word out there as we possibly can. And then Sarah's like, will you be sharing with providers, participants, and entities a copy of the letter going out to Medicaid members? I think that's something that we can share with, you know, our listserv. I know Amir will be listing or sending out an email, you know, asking for contact information from anybody who wants to be on that letter. So part of that letter does also have like a brief info of what is this program, how can it help, how to get in contact with us, and then has some phone numbers and organization names. So that way it's another level for Medicaid members to reach out and get a hold of someone.
Yeah, I reached out to organizations that are contracted to provide navigation services to be included in the letter. But yeah, we can definitely share a copy of that letter in a future communication before we send it out. Thank you, Melissa.
Yeah. And then just for in timing with that letter, what we're aiming for is the end of July or that first week in August. So that is our time frame. So very shortly, we're going to be getting that out to the community. And that was it for me.
All right, it looks like I'm up next. Good afternoon, everyone. I see several familiar faces, but for those of you who don't know me, I'm Olivia Berlew. I'm the Director of Revenue Cycle here at Care Compass. Lauren asked me to speak to some of the new invoicing standard changes that have come down from OHIP. So next slide, please. I just wanted to take a moment to introduce the team behind our revenue cycle work. Our newest addition, Kaylin Bourdon, is our revenue cycle billing and analyst specialist. She bridges billing and the numbers behind it. Like I said, I'm Olivia Berlew. I'm the Director of Revenue Cycle, and I lead the overall function and strategy of the team. You may remember Monica Christian from her previous role as the NPS for screening and navigation, but she is now our manager of revenue integrity and compliance, and she keeps us accurate and audit ready. And last but not least, Kelly Hogue and Jesse Ely, our fabulous billing specialists. They handle our weekly invoice approval to ensure you get paid. So why does RCM matter in our SCN waiver work? It strengthens revenue by minimizing claim denials, reducing days in accounts receivable, and increasing collections so providers get correct and timely payments. A strong revenue cycle also helps us keep compliant with regulatory compliance requirements and improve member satisfaction. Next slide, please. So with the release of version 6 of the Data System Implementation Guide, or the DSIG, Social Care Network lead entities were informed of OHIP's new invoicing requirements of 5 days from the date of delivery. Care Compass thought about this, and then we recognized that implementing these changes would be a significant effort for our partner organizations, especially while transitioning from our build year into our performance year. To support our partners through this transition, we adopted a phased implementation approach and established the following invoice submission deadlines. So all of 2025 were due to us by May 31st. All of Q1 of 2026 were due in by June 30th. And all April and May 2026 service invoices were due by, or actually going to be due by July 31st. Effective July 1st, CareCompass Network's timely filing policy went into effect. Under this policy, partner organizations are required to submit invoices within 30 calendar days of the date the service submission comes under the provider's control and is ready for billing. So what does within the provider's control actually mean? Let's take a closer look. Next slide, please. So within the provider's control, CareCompass Network recognizes that invoicing timelines can vary depending on the type of service being provided. For that reason, we've aligned our approach with the way that Medicaid evaluates timely filing requirements. Under Medicaid billing rules, providers are expected to submit claims within a specific time frame once they have the information necessary to do so. For example, when a member has insurance coverage other than Medicaid, providers must wait for the primary payer to process that invoice before billing Medicaid. The timely filing clock does not begin until the provider has the information needed to submit the invoice. So we have adopted a similar approach for SCN invoicing. The 30-day timely filing clock begins when the invoice can reasonably be submitted because all required information and supporting documentation are available to the provider. A couple of examples. When we look at food and nutrition services, if your organization purchases, prepares, and distributes food boxes directly, your costs are known at the time the service is provided. In these cases, the 30-day timely filing period begins when the food box is delivered. But if your organization uses a third-party food box vendor, the cost may be not known to you until you receive the vendor's invoice. In these cases, the 30-day filing period begins on the date of the vendor invoice because that is when the expense comes within your organization's control and can be billed to CareCompass. Services that require external documentation, such as external parties using vendors, statements of work, technical review from providers. If you have not yet received the invoice or documentation needed to determine your cost, you cannot reasonably submit that invoice to CareCompass. In these situations, that 30-day filing period begins when the required invoice or documentation is received. When we look at something like enhanced care management, for these services, if you're billing for a single date of service, the 30-day filing period begins on the date the service was provided to the member. However, since you do have a 5-day billing span allowable, the 30-day filing period would begin after the final day of the billing span, when the service period is completed and ready for invoicing. Next slide. So some key billing considerations. First and foremost, at the heart of what we do, member eligibility and coverage. You must confirm the member was eligible on the date of service and that the service is covered under the member's SCN benefits before submitting an invoice. So what does this mean? This means from navigators to service providers, we are all required to hit the RTE button prior to service delivery. It is a requirement of Medicaid outside of SCN waiver, and it is also a SCN waiver requirement. If when you hit that RTE button, it does not show MCO coverage for an enhanced member that you are delivering services for, we must stop. Do not proceed unless you're giving level 1 services. If you are running RTE and you find that that member has no coverage whatsoever, I would encourage you to work with that member to get their eligibility reinstated. But until that happens, we're not able to invoice for any services that are provided during that time frame. Next up, service delivery and documentation. For every billed service, it must be supported by documentation showing the service was provided, when it occurred, and whom it was provided to. Acceptable proofs of delivery. You need to maintain evidence that the member received the service, such as delivery confirmation, case notes, vendor records, or member acknowledgements as applicable. And then finally, our billing timelines. Submitting invoices within 30 days of the date of service or when the cost comes under your organization's control. Timely billing helps prevent rejections, denials, and compliance issues. Next slide, please. So, key billing best practices. Before submitting an invoice, please make sure Medicaid coverage on the date of service has been verified either through e-paces for those of you who have access or by using real-time eligibility in Unitas. Make sure that you're checking to see that there is a check mark by them because I've seen RTE run and there's been 2 red X's and we've proceeded. So please make sure that it's showing that it's active. If you have any questions about a member's eligibility, if it doesn't seem right to you, please reach out to Care Compass. We will be happy to look into that for you. Another thing that you need to be sure of before you submit an invoice, that the member is attributed to Care Compass. We have members that will move from Healthy Alliance to Care Compass and not update their information with the state. That is critical for reimbursement purposes. If that member isn't attributed to Care Compass, just because you add Care Compass's enhanced HRSN social care coverage does not mean that member is eligible. You need to make sure you're verifying it says Care Compass under the screening and eligibility social care coverage before proceeding. We also need to, as reasonably as possible, make sure that that member is not a part of the excluded population. So we may not always know at the time, simply because our disenrollment file is not integrated into UniteUs. But if a member were to say that they were a part of any of those excluded populations, do not proceed. Contact Care Compass. We have a mechanism for checking on those for you. You also want to make sure that that member is eligible for the service being billed. UniteUs doesn't have any guidelines around referrals being sent. So if you see that the member wasn't eligible for housing on the eligibility assessment, the system will still allow you to send that. Now, we do try to catch those as best as we can through service authorizations, but we also don't want to set that member up for disappointment and saying, well, I'm going to refer you for housing when they obviously did not qualify. Another thing that we want to make sure of before we submit an invoice is that the service has been fully delivered. That is a part of Medicaid guidance, Medicaid compliance. So if the service is not fully delivered, you cannot bill us until it is completed. A couple of organizations may have seen some rejections on invoices where they pre-billed for dates of service out in the future, which is that they're not future dated. You want to make sure that your required documentation is uploaded and complete. Please, please, please make sure your documentation matches what is invoiced. Make sure that you have the correct service type, units, payment amounts have been selected. UniteUs has a little glitch where if you use the scrolly thing on your mouse, it'll take it down by however many cents that you scrolled by. So please make sure that if you're billing me $175, it's not $174.90. Make sure your total billed amount is within the New York State fee schedule limits. We've gotten a lot better about that over the time, but just make sure that if the cap is $146, we're not billing for $147. That's going to result in an automatic denial. All required invoice fields have been completed. No duplicative services or duplicate invoices exist. This is not encompassing enhanced care management, where we understand that if you are working with a member on different SNOMED codes for needs, that you would have to create different ones. We're talking more along the lines of weekly invoicing for nutrition. We can't have 2 invoices existing at the same time for those same dates. Also, please make sure that your timely filing guidelines are met. If you are having trouble meeting our timely filing guidelines, please reach out to let us know what those barriers are. We're happy to come on site and try to help you figure out where some of those bottlenecks exist. Next slide. So key billing best practices: invoices may be rejected if coverage was inactive on the date of service. RTE was not checked. That is a huge one that you will be starting to see if you're not checking RTE. The member was no longer eligible for SCN services. The member was not eligible for the service provided. Eligibility cannot be verified. Services were delivered after coverage was terminated. Your documentation is missing, incomplete, or does not support the service billed or does not verify delivery. The administrative fees are not calculated correctly or included for time-based services. And if the invoice is submitted outside of the defined range for Care Compass's timely billing expectations without notification of there being an issue going on. Next slide. So building a strong foundation for reimbursement. I like to say that documentation review is not just administrative work, it is compliance work and revenue integrity work. Our billing specialists work very hard to make sure that we stay within New York State compliance. And New York Medicaid has some of the most rigorous billing and documentation requirements in the country. As social care network programs continue to evolve, providers must be prepared to meet both current OHIP and invoicing standards and broader Medicaid compliance expectations. Our goal is not simply to avoid invoice rejections. It is to help our partner organizations build strong billing practices, support audit readiness, ensure timely reimbursement, and position themselves for long-term success in a Medicaid-funded environment. This is really the why behind everything we've covered today. We're not asking for detailed documentation and timely invoicing to create more work for you. We're doing it because there are the same principles that underpin Medicaid compliance. New York Medicaid is very high documentation and billing standards, and as the SCN matures, we want you to be successful. Next slide. Finally, we want to end with who to contact and when. So for invoicing support, you would want to contact the SCN Invoice Help Desk at scninvoicehelp@carecompassnetwork.org. And you're going to contact that when you have invoice or rejection specific questions. We have our SCN Help Desk, which is contacted when you have general questions about the SCN, and our AP at carecompassnetwork.org. This is when you need to contact for questions related to payments received, but the questions are not invoice specific. Our AP department does not have invoice specific, like rejection reasons or things like that. That would go up to our SCN Invoice Help. And I also want to plug our upcoming SCN Invoice Office Hour event. Monica and I will be there to discuss any invoicing related questions you may have. So please make sure that you register, and the link is down at the bottom.
Olivia, there is a question in the chat from Kurt. Can you see it?
Hold on just a second. Let me get down there here. All right. The question is, what is your suggestion for checking insurance verification for services that need to be ordered several days in advance to be available for the data service? What do other orgs do for this? I'm guessing, Kurt, that you're talking about, for instance, like food boxes.
Yeah, that's the one that I run into.
And that is one that we have an open question out with to the state. We do recognize that you might have a delivery week that starts on the 29th, and that member is ineligible the first of the following month. And there's no way that you can reasonably know that, because when we do RTE, it's in that moment. So I am working with them to try to get up a better workflow for those of you who are having to order those boxes in advance. We can't stop those boxes from going, just to see what their thought process is on it. And that further guidance will be coming as soon as OHIP gives that to me.
Okay, thank you.
But whenever reasonable, if you've checked RTE, say that your box is going out on, the 29th, you've checked it on the 29th, because Medicaid generally, I say generally because they do have some exceptions, ends at the end of the month or begins at the beginning of the month. If you checked on the 29th and it was eligible, and on the first they weren't, we will work with you to make sure that you get reimbursement. We're not going to leave you high and dry on those. It's more, we see this with some organizations that don't check RTE for months, and then they've gotten lucky for February, March, and April, but come May, they're no longer eligible, and they've got 4 weeks that they just bill us, and that's outside of our control. If RTE had been hit, we would have been able to slow that down. Oh yes, Maria, hopefully next week. Let's see, is there a history of eligibility verification used, maybe a look back period for members that were eligible during service, but then 1 to 2 days later after submitting the invoice, verifying they're no longer eligible? So the Unitas platform, when you hit RTE, it's going to come back and say the date that you hit it. So I'm able to verify, like if you worked with a member in June, but you didn't hit RTE in July, I can see by the end date on the coverage reasonably that it wasn't hit within that month, because if it was hit within that month and it was still good, we would be good. But if you hit it in July, it goes back to the last day of the month prior to it. Stephanie said, I had a similar question in regards to transportation. If when I speak to the member and work on the arrangement of the ride and they qualify, do I need to set the following month when invoicing? Yes. before the service delivery is happening, yes. But Stephanie, for that point, if you're delivering like a 31-day bus pass, and on the day that you verified eligibility for the first day of the 31-day bus pass, if you use that service delivery date of the first day of the bus pass, the state will reimburse. They've said that as long as they were eligible on that first day. Gret, can we look at that offline together with some examples that you have? I think it would just be easier for us to look at the individual cases than speculate. Thank you. All right, if anybody thinks of anything else between now and next week, hit that register button and we can chit chat.
Alexa did drop the link to register in the chat as well, because I know you can't access it on the slides right now. Okay. Next up is Dina.
Hi, thank you, Amira. Next slide, please. So I'm here to talk about the Insights dashboards. I know a lot of you already have access to the dashboards, and I hope that you're finding them useful. If you do not have access to the dashboards, here you can have 2 licenses per organization to log into the dashboards. All you have to do is email me and request access for your users along with the email addresses, and I will get that over to Unitas to get you activated. The dashboards are just some basic analytics on the services that you're providing, the screenings, the assessments. There's some analytics on the invoices, open cases, rejections, things like that, where you can look at your organization as a whole. My access at Care Compass, I have access to all the organizations, so it's going to look a little bit different for me than it will for you. So the standard dashboards that you have access to are the community organization, the health equity dashboard, and the core user performance. That's basically just Unitas as a whole within New York State. I'm going to dive a little bit deeper into the 1115 specific dashboards, which I think everyone would be interested in, the activity, the screening and assessments, and the invoicing. So when you do get your access to the Insights dashboards, you'll see here that you'll have a tab when you log into Unitas, and that will show you that you have your Insights access. I've had several emails where I've said that people had their access and they didn't know where to find it. So I wanted to be sure that everyone knew where to find the tab to get into your Insights dashboards. Next slide, please. The other thing that I receive a lot of questions about is getting training on the dashboards. The dashboards are driven through Tableau, and they aren't, Tableau isn't super user-friendly. So there are some trainings that Unitas does have available for you. If you go to the graduation cap in the top right of your dashboard, your landing page when you go into Unitas, they have the training on the invoicing dashboard, the activity dashboard, and the screenings and assessments that you can register for. And it does give you a tutorial on how to navigate, how to use the dashboards. I think you'll find them very helpful. The second way to get information about how to use the dashboards is to use the question mark in the platform, and that will give you some written articles explaining what's in the dashboards, how to use them, certain tips and tricks and things like that. Is there another slide or is that it? Is there one more slide?
I think that it is time for me to stop sharing.
Okay.
Yeah.
I'm going to go into my dashboards. One second here. Okay. And excuse me, I'm going to be looking at my screen to my left. So this is my landing page. So I do have more access than the CBOs do. But let's go into the activity dashboard. Okay, so here you can see at the top here, you've got cases, referrals, managed cases, and service delivery. Here you can toggle to certain dates if you want to check the last 30 days. When I first started using these way back when, I was using the slide and it was getting very annoying because it was skipping through dates. And then I realized that you could actually click on the date and a calendar will come up. So little tip there. You can also filter down to different filters, fee schedule, programs, and cases, and also down to a member, state and county, and zip code. I wanted to draw your attention over here to the info button. That will show you exactly what this dashboard is doing. So it just explains the activity on or after January 1st for members enrolled in the social care coverage for the 1115 waiver who completed both the AHC screening and the eligibility assessment. It gives you some date definitions and some key terms. I also wanted to call your attention to this down here. If you click on this book here, you'll get some measure definitions, like how they're measuring certain dashboards in here. Kind of a breakdown explains how they've come to these figures that you're seeing. Another question that I see a lot is how do you download these dashboards? There's several different ways that you can download the dashboards. You would go up to this little, I don't even know what you would call it, but up here, you can get an image of the dashboard. You can get a PDF of the dashboard. And actually what is kind of cool is if you wanted to present this to your leadership or, you know, if you had to do a presentation on your numbers for the 1115 waiver, that it will put it right into a PowerPoint slide for you, which is kind of cool. So I'm going to go back to and forewarning, Tableau, it can be a little glitchy too. It's a little slow, unfortunately. Okay. Next, we can go into the invoicing. All right. Oh, and it's throwing me an error. Great. So here you can see what you've invoiced for, the services, the total amount that you've invoiced for. You can break it down into programs on how much you've invoiced per program. You have down here the different, it goes month by month. Your invoices in progress, the number of rejected invoices, and the amount of invoices that have been paid. And again, you can download this information by going over here and picking how you would like to download it. The data dashboard, that will download it into Excel, where you can download it again and manipulate the data from the Excel spreadsheet. You can also go into paid invoices and rejected invoices as well, and it will give you a breakdown of those invoices. Let's see, the last dashboard is the screening. Oh, there's another error. Screening and assessments dashboard. Okay, so here you can see the amount of screenings that you've done. Like I said, I have access to everyone's dashboard. So you're going to see different numbers that are just going to be for your organization. You can see the screening results, how many people have answered, you know, specific questions, screenings by health-related needs, the number of screenings with at least one need. And if you click over here, you can change the number of needs. And you have your, you know, your general filters over here on the left. The screening, you can identify the identified needs if you wanted to just break it down by how many people have I screened that have a food need or a housing need and so forth. So you can break it down that way as well. And then the eligibility assessments. This will tell you, you know, how many eligibility assessments you've done. It will tell you how many you have in draft, how many you've completed, how many have been declined. So that is some good information to have as well. And those are the 3 dashboards for the 1115 waiver that you currently have access to. If you don't have access, again, please send me an email with the name and email addresses, and I will send that over to Unitas, and it usually takes about 5 business days to get you access. Are there any questions?
Can we drop in the chat just the email address for people again if they don't have the insights, please? Thank you. All right, so moving along to provider scorecard launch. I know we talked about this at our regional provider convening in June, how we were going to provide organizations on a monthly cadence with scorecards that would give you an overview of how you're operating with the key performance metrics within the program. So building off Adina's overview of insights, where you're navigating through those reports and reviewing those, we are also going to provide you with a monthly cadence of reporting. So you will be able to determine how you're functioning as well. Next slide, please. So again, in this environment, we really want to support you in understanding that volume and quantity of services that are being delivered and invoiced for, and really want to transition to being proactive in adjusting any workflows, providing that support that you may need, ensure that we align with our program goals and really meeting those members' needs as necessary. So what you can expect moving forward: initial scorecards will be sent on July 23rd. That will include all the information from January of 2025 or whenever you were live and actively providing services for the SCN through June of 2026. That will be a snapshot of about a year and a half of your services that have been provided. You will see 4 different report cards, and one will be of screening, one will be of screenings that have identified needs, one will be of eligibility assessments that were completed. It will give you some additional metrics of gaps or members that might need those eligibility assessments completed. And then the final slide will be your invoicing slide. So that's how many services have you rendered, those total amounts, rejected invoices to meet that goal of less than 5% rejected invoices. And then those will offer you the opportunity to then review your data, reach out to us with any questions you may have so that we can support you moving forward. After this initial July 23rd scorecard, the scorecard will be distributed monthly on the 3rd Monday of each month, and it will reflect prior month's data for your review. As you review that scorecard, really looking at any trends, gaps, and opportunities for improvement, determining whether any follow-up is needed, any operational adjustments that might be needed to support that continued progress, really reaching out to your network support specialists in those specific domains, screening nav, housing, transportation, and nutrition, to really determine how you can best move forward with ensuring you're providing appropriate services for members, and that your workflows are concise and meet the needs of the members and your internal functions. And then we will use these scorecards also as discussion points for collaborative conversations, some additional action planning, that continuous improvement. And for those of you who have capacity awards, we will also review those scorecards at those meetings as well. Next slide, please. And then this is just a sample of a scorecard. This is the invoicing scorecard. So you'll see the number of invoices, that total amount that's been accepted and amount that's been paid, the status, that rejection rate in the bottom corner, your monthly invoicing total. Invoices by submitter will actually give you the staff name who has submitted those invoices, the invoicing types, whether it's an enhanced HRSN service or a screening, and then the programs that the services have been submitted for. And that is everything on provider scorecards.
All right, I am last up to round us out in the last 18 minutes here, and I'm going to do my absolute best to do that. So for those of you who don't know me, I'm Lauren Greco. I'm the SCN director. And we can go to the next slide, Mira. Thank you. All right, so as we shared in our June in-person event, there continues to be a lot of exciting movement for our team, both related to promotions and new position opportunities. So today I would like to say congratulations to Desiree Humphrey, who has been promoted to Network Performance Specialist in Housing. Also, congratulations to Nathan Marble, who has been promoted to Network Performance Specialist, Screening Navigation, Referrals, and Case Management. And we are going to shorten that title at some point here. I would also like to take a moment to welcome Kendall, who's our social care navigator, who started with us just on July 6th. So as you can imagine, Kendall is very, very involved in the onboarding processes. Additionally, we are thrilled to inform you that an offer has been accepted for our member experience specialist position. And she, to be announced in the future, will be starting on August 10th. So more to come on that. And then we are diligently working on filling other positions, some of them backfill. So our network support specialist, our social care navigator position, and we have several social care coordinator positions. So much more to come on that. But congratulations and welcome to everybody for all those exciting updates. And you can go to the next slide, Amira. Okay, so hot topic, waiver extension update. There's a lot of information here, so I'm going to just try to unpack it pretty simply for the time we have today and then give you some next steps. So as you all very well know, over the last few months, we've been talking a lot about a specific call to action to provide timely quality services and then invoice timely and accurately, like Olivia was just talking to us about. This is the way that we drive and demonstrate programmatic impact to New York State, right? So echoing and advancing this call to action is a new proposed 1115 waiver extension, which was just released by the Department of Health on July 8th. So looking at our timeline here, there's a few key dates and actions that we can pull back out. So that draft waiver renewal proposal has been submitted to CMS as expected. We have officially entered the New York State public comment period, which extends from July 8th to August 21st. And of course, this is going to be our current area of focus and impact. The deadline for the New York State public comments is August 21st. And then from August 21st to September 30th, New York State will work to incorporate feedback from that public comment period into their final submission for CMS, which is due on September 30th. And then following that deadline, there will be a federal comment period, most likely in October, but the specific dates are still to be announced. And you can go to the next slide, Amira. So pulling out a few things, and if you've seen the extension proposal, there's a lot in there, right? So these are just a couple highlights, most of them specific to the SCN for our discussion today. But the proposal is to extend the waiver for 5 years. For year one, New York State is asking that they maintain the health-related social needs, or the HRSN services, that are available through the social care networks today for one additional year. And they are looking at doing that through funding. I'm sorry, they're looking at funding that through existing unspent waiver funds, which is approximately $2.1 billion. Let's see here. Then, after the first year of the extension, all HRSN service delivery would actually be transitioned into New York's Medicaid managed Medicaid program. By doing this, HRSN services funding would actually shift from 1115 waiver program into the New York State Medicaid managed care program. And that's really the continuity there. But New York State believes that this additional year, so looking at April 2027 through March of 2028, will really provide the state some additional time that's needed to collect sufficient encounter data, utilization data, and cost data, which will allow them to support and refine rate reimbursement schedules, and then also ensure compliance with managed care rate setting requirements. So there's a lot in there, but basically we need more time to do what we're doing and build the data sets before we enter the next phase there. Can you go to the next slide, Amira? All right, a few things here. Care Compass is highly supportive of waiver continuity. We believe that extending the current services provides an appropriate bridge while New York State develops that future Medicaid-based HRSN service model. The goals and objectives that are outlined in the proposal are very aligned with what they are currently, and they're intended to maintain and really further operationalize what we're doing today. And we've just pulled them out there for us. And you can go to the next slide, Amira. So within the proposal, there are a number of SCN accomplishments that have been highlighted, really helping to build that case that social care networks across the state are functioning, they exist, and that these networks have proven their ability to engage Medicaid members in their designated regions. We really see those highlights in four main categories, which we have broken out here for you. But really looking at that statewide service delivery infrastructure. So we have been able to scale regional networks and build provider capacity to really enable the program and screen over 1 million members over just 22 months, right? And that's just talking about screening. We've also been able to build new capacity in our community to deliver those services through training, upskilling, and local investment. Looking at an integrated care approach, we've helped to develop that person-centered integrated care approach to improve outcomes for high-need populations and really help to address those persistent drivers of chronic disease. We do deliver evidence-backed HRSN interventions, right, to reduce that overall healthcare costs and outcomes. From an accountability and fiscal oversight perspective, we work to drive accountability, performance, and really provide oversight of those HRSN service delivery and the associated invoicing. And then, of course, when we're thinking about data and technology, we really have established that technology backbone, as New York State calls it, that helps support that data flow and encounter levels across New York State, right? So that in itself is just an incredible accomplishment. This infrastructure does allow us to share that data and the insights that are related to that across the service delivery continuum. So just really incredible, and I just wanted to pull out what was highlighted there. All right, next slide. So as we think about this call to action in this public comment period that we're in, you may have a thought such as, what can I do to help with the waiver extension? And so as we're all very well aware, since January 2025, The services that we've delivered through the social care network here in the southern tier has really had a profound and significant impact on the lives of our Medicaid members in our region. While the work has been challenging and a lot of times operated on short-term timeframes, right? We've had to remain flexible through all of that. Your public comments can really help encourage CMS and the federal government to approve the New York State submission. And really the purpose of that and our focus right now is just allowing this work to continue, right? For the next year and for many years to come. So public comments that are gathered by participating organizations like yourselves are incredibly helpful to demonstrate to New York State and CMS what's truly happening at the grounds level. So while we at Care Compass, we do intend to provide public comment, it's also critical that all of our participating organizations directly share their feedback during the public comment period as well. And it's important to note, like I teed up on that slide in the beginning, there's actually two kinds of feedback and two distinct opportunities for that. So one submission can be made to New York State, and the other submission can be made to CMS. Feedback can be shared either in a written format, it could be shared in person, or it can be shared verbally, like through spoken remarks in one of the existing forums. So you as an organization, you can do both. Either mode of feedback is received and handled in the same way. So basically what that means is whether you have a written comment or whether you have a spoken comment, they have the same weight at the end of the day. So you also may be asking yourself, which public comment period should I submit my feedback to? And so the answer to that is both. We actually recommend that organizations participating with the SCN specifically submit comments during both periods. And really what that means is that the comments submitted during the New York State public comment period, so right now, those are going to be incorporated into the final waiver submission to CMS, which is due again on September 30th. Then the comments submitted during the federal comment period, those will be submitted directly to CMS, and those will be incorporated in their final waiver review process. So once that final application is submitted by New York State, CMS will enter their review periods, right? And so they'll use those direct comments in that evaluation as well. So just as I've shared, right, that first priority is to submit feedback during the New York State public comment period prior to that August 21st deadline. Here on the slide, you can see there's two opportunities for this. The first is in person in Albany on July 31st, just following the United Hospital Fund Conference. And then the next opportunity will be a virtual option on Tuesday, August 11th. And there are details associated with both of these opportunities that is in the communication that we shared out in last week's SCN newsletter or weekly communication on July 10th. And we're happy to get those over to you if you do not have them. And you can go to the next slide, Amira. All right, so just rounding out on next steps here. We are going to have an open office hour for the SCN. I'm going to just pop that information in the chat right now. You don't have to register. It's just an open invitation. It's my personal meeting room. We are going to actually have several folks from SCN leadership and Care Compass leadership in attendance, which we can review the waiver extension further, answer questions, discuss public comment approaches, etc. Additionally, we are going to be providing you with some tools and information. So as Nicole shared, each of our contracted providers are going to get that scorecard next Thursday, the 23rd. that will have specific details on services that your organization has provided since January 2025. And so you'll have that in your arsenal for your submission. And we also are working on a provider toolkit and some talking points, just with some more of those best practices and different ways to help you with your submission. And then lastly, if you have any questions or would like some tailored support with that submission, you can just reach out to me directly. I think most of you have my email address at this point, but I've got it there on the slide. And we can coordinate a time to meet either with myself one-on-one or with a member of our team or leadership team. So,
Lauren, Michelle did ask if tomorrow's open office hours will be recorded.
We're not planning to, Michelle, but I think the takeaway from that would be collecting notes, almost like a fax document to put into that toolkit, if that would be helpful. But I can ask about recording. I definitely can. Are there, I know we've only got a few minutes left. Other questions that I missed maybe, or that people would like to ask? Just digesting all of the information. It's a lot. It's a lot. It's a really exciting time for us. We knew it was coming. We've been anticipating that, and now it's time for action. So, like I said, lots more to come on that piece of things. So stay tuned, and please reach out with any questions that you have at all. I did have a few more slides in there just related to data, but I think we'll go ahead and just share those out. There's only a few in there just with some updates on screening and different types of services delivered. So we can just open it up, I think, maybe for other questions, or Amira, I think you probably have a survey that you want to share.
I just dropped the link to the survey in the chat. Yes, please tell us what you think, give us your feedback. And yeah, we'll send the slides out following the meeting. I'm gonna stop sharing. All right. Gonna leave it there on that one. Are there any questions, anybody?
I just see a question. So Alex, this is the
I'll send Lauren's Zoom link to join tomorrow. I'll send it in the follow-up email with the slides so that you have that in your email and you can join that meeting tomorrow.
Okay, thank you. I was referencing the Tuesday, August 11th
Yes.
as well. Okay, thank you.
Okay. Yep. If there's no more questions, thank you, everyone.